This podcast is intended for axial spondyloarthritis patients and has been initiated and funded by UCB Pharma Limited. Information contained within this podcast is not intended to be a substitute for consultation with your healthcare professional.
So obviously axial spondyloarthritis affects a younger cohort of patients, Hassan, and at a point when people might be thinking of starting a family. So is there anything that patients need to consider?
If you are planning to start a family, or more importantly, if you do fall pregnant, we would recommend you do speak to your rheumatology department or your rheumatology team. The key here is that if you are planning to start a family, you should ideally have your symptoms or your condition well controlled for at least a period of 3 months prior to starting family planning. Important points to note is that axial spondyloarthritis does not affect fertility or have any harmful effects on the course of pregnancy or the well-being of your unborn child. Some of the drugs that are prescribed to manage your axial spondyloarthritis may be stopped during pregnancy by your rheumatology team, so just bear that in mind. It is difficult to predict what will happen to your axial spondyloarthritis symptoms during pregnancy. Some people will experience a reduction in symptoms, but conversely, some describe increased pain. And this includes patients who have been on treatment, they've been well managed and well controlled. There is a risk that you may flare. And again, these are conversations to be had with your rheumatology team.
And I suppose another point, Hassan, is also it's helpful to think about how you're going to continue to manage your symptoms once the baby has arrived. So it's really important to discuss this with your partner and wider support network, as you may need their support from time to time to ensure that you can continue to help manage your symptoms and have time to look after yourself and your well-being.
Absolutely agree.